Very warm welcome to our biology class. Today in this class we are going to understand regarding the barrier contraceptive methods. In our previous class we have already understood the natural contraceptive methods. We have know that how that all the natural contraceptive method works, and each and every contraceptive method, how many days or how many months that particular method works, that all the things we have already understood, students. But suppose for example, if the contraceptive method fails, because the failure rate is very high in the contraceptive methods, but the couples are actually thinking at any cost they want to have a gap between the first and second child. So then they may choose these barrier methods, any one of the barrier method. Many barrier methods are there, students. What are these physical barrier methods then? Whatever the physical barrier methods are there, students, they are the one who helps in prevention of sperm and ovum from their physical mating. They are going to act as a barrier. Okay? They are going to create the barrier by which what happens? Sperm and ovum will not able to come closer with each other. Then let us see that what barriers are available for the male and what barriers are available for the females. There are different barriers are there for the male and females. We'll see one by one. First we will understand regarding the male physical barriers, and then we'll go for the female physical barriers. For male, condoms are available. Now let us first understand the condoms. Students, whatever the condoms are there, all those condoms are have one common shape. What is that common shape? They have a one ring like structure like this, and this is connected with a tube. This is what the way how the condoms are. So these are all made up of rubber or latex sheath. Got it? And whatever this rubber or good quality latex made condoms are there, this has to be used before going for the coitus activity. Whenever the man is going to become sexually excited, by that time what happens? Once the penis get erected, then these condoms are going to be fixed upon that. Means they need to cover penis. Suppose now once the man has covered the penis, then after that if he is going for the coitus activity, what will happen, students? 100% the semen is going to be ejaculated inside the condom. Automatically what will happen? It will not be deposited in the female reproductive tract. It will not be ejaculated in the female reproductive tract. And if it is not ejaculated in the female reproductive tract, then whether there is a question for getting fertilization? No. Sperms are not at all take an entry into the uterus, or even they are not able to reach to the site of fertilization because they were not ejaculated, they are not deposited in the female reproductive tract. Then how does they can able to move over there? So that's why this is the one good method by which we can able to have a space between the first and second child. But thing is, every time they have to go for using. If suppose for example any couples are using these condoms to have a contraception, then every time in every coitus activity they have to use it. Okay, anyhow, students, but these are the good methods. Even they are going to help in prevention of STDs. How they are going to help in prevention of STDs, that what we will commonly understand once we understood the female condoms. Okay? But now try to understand how the condoms are going to work out here. Students, there is one of the well-known popular brand of condom is available in all over the part of India. It is Nirod. You should remember the name Nirod. It is one of the popularized brand of condom. Yes, it is very even necessary that if their couples are following this method, they have to use the good quality condom. Suppose, for example, if low quality condoms are there, then what will happen? There may be the chances of that condom is going to be ruptured while having a coitus activity. Then for what purpose they are using, that purpose won't going to be filled up. Okay, so that's why they have to use the good quality condoms. Okay, this is what all about the male condoms. Then we'll go for the next one. What are all the barriers are there for the females? Yes, for females, even female condoms are available, and those female condoms are commonly called as femidomes. We'll understand about those femidomes in detail. In addition to that, for females, even diaphragms are available, and cervical caps are available, and even vads are available. Okay, we'll understand all of those one by one. First, we will understand regarding the femidomes. How does these femidomes are going to work? Yeah, we will understand. Okay, first we will understand how they are made up of. Listen, now observe here, students. Whatever the femidomes are there, femidomes are made like with a two ring-like structures. Yeah, I will draw here this what the one ring, and this is the another one more ring. And this ring like complete tube-like structure is there. Yeah, it is like the tube-like. So probably you might be understanding now. This is the tube-like. I will just draw the tube-like. But whatever the in this, suppose now it is the outer ring. Outer ring it is. Okay, just I will label it like this. It is the outer ring, and this is the inner ring. It is the inner ring over here. Okay, I will label both of this. Whatever the upper diagram I have taken, it is from the NCERT book. You can check it. But whatever the inner ring is though there here, students, that inner ring is completely covered, closed. It is the closed one. This inner ring is closed. Outer ring is opened one. Now let us see that how these are going to be fixed and how they are going to be utilized, how they are going to be used. To understand that how they are going to be fixed and how they are going to use, we'll just simply draw the female reproductive system. Yeah, I will draw here the female reproductive system. Try to understand it. Okay, this is what the female reproductive system front view I am drawing. Yeah, these are the fallopian tubes, and this is the uterus, and here cervix and vagina is there. And on the either side of uterus, we used to find the presence of ovary over here, and here there is one more ovary is there. Fine. Okay, I will just even complete the fimbriae over here. Fimbriae are there like this, and even fimbriae are there. And all of you know that here the cervix is there like this. Yeah, and cervix have a cervical canal, and next to that the uterus part is there. How they are going to be fixed then? Okay, see here, whatever the inner ring is there, and these are the self-usable. Yeah, no need to be have any doctors or anyone else while using these condoms. Whatever this inner closed ring is there, that has to be placed upon the cervix. Yeah, I will just try to show you over here. Suppose this is the inner ring. Yeah, so I told you inner ring is a closed one. And whatever this outer ring is there, students, this outer ring is going to be fixed in such a way that it is going to cover labia minora. Yeah, you know that there is a female external genitalia, labia majora, labia minora, that whatever the inner skin folds are there. So by covering that inner skin foldings, labia minoras, the outer ring is going to be fixed. And whatever the entire tube like is there, that tube is going to be lies just along with the wall of vagina. Yeah, and after that they can go for having a coitus activity. What will happen then? Once the coitus activities ends, then what will happen? Whatever the sperms are there, students, those sperms are going to be released in the condom only. They are not able to take into the uterus. Why? Because already we have fixed the barrier over there. It is the femidomes, condoms we have fixed over there. This is what the way how the female condoms are going to work. But suppose, for example, couples are there, and if the husband is using the condom, by that time the wife need not to use the condoms. If wife is using a condom, then by that time husband need not to use the condoms. Vice versa. Both of them are known not to use the condoms, and even if they use, that will be the given better result, better contraceptions, that's all. That is good only, even if they are using it, to have a more percentage of contraception, they can go for that. But if anyone are used, that is enough. Now I told you even initially, students, whatever these contraceptive methods are there, means the male and female condoms are there, these are not only helps in getting a contraceptions, but these are also even going to help in prevention of STDs. Prevention of STDs. What are the STDs, students? STDs are sexually transmitting diseases. Whatever all the sexual transmitting diseases are there, like HIV, hepatitis B is there, genital herpes is there, genital warts are there, syphilis is there, many such type the different STDs are there. So those STDs will not be transmitted from infected person to the healthy person if they are using these barriers only. Means prevention won't occur by using the diaphragm, cervical cap and warts. Why? Because they are not covering the entire region of the reproductive tract. Means actually why the STDs will pass at the time of sexual contact, that you should know. Suppose, for example, if the both of them are not using the condoms, then what will happen? There will be the friction between the surface of the vagina and the surface of glands penis. Because of that, what will happen? Minor ruptures are occurred, and due to that ruptures, blood is going to come in contact, the fluids are going to come in contact, and because of that, through that fluid, what will happen? The infections is going to be transmitted from one person to the other person. But what we are doing here, we are covering it completely, so that will help us to get the prevention of STDs even. I hope you understood how these are going to help in prevention of STDs. Okay, now we'll go for understanding how the diaphragm, cervical caps and warts are going to help, how they are going to be utilized even. Okay, first of all, we will understand how they are all made up of them. I will simply draw here the diagrams of all those barriers. One diaphragm is have a cup like structure. You can observe here, this is what the way how the diaphragms are, and even the cervical caps are also similar way, but in a design they are comparatively different. In a design, I will just draw here, this is what the way how they are designed, and even warts are also designed in the same way. Okay, I will draw the warts now. You can observe here, this is what the way how the warts are made up of, right? This is what the way how they are made up of. Usually whenever they are going to use for this diaphragm, cervical caps and warts, they are not going to be just use only this, but they are going to use along with chemicals. Whatever the chemicals are there. What chemicals these are? These are actually spermicides. We will understand about those spermicides in our next class. Now, where they are going to be fixed and how they are going to be used. Whatever these all diaphragm, cervical caps and warts are there, they are going to be these can be reused, students, even. And what they need to do is, before going for fixing these diaphragm, cervical caps and warts above on the cervix region, they have to clean it properly, and they have to take just 1 or 2 drops of spermicides into that and apply it on all the side inside to that cap or cervical caps or diaphragm or the warts, and they are the rubber made. even they are the very flexible. So just by pressing little bit, so woman can able to fix it on her uterus through the vagina. Yes. Yeah, now you can observe. Yeah, just I'm going to fix it how that all the diaphragm and valves are going to be fixed. Yeah, I told you bit slowly they have to press, and if chances keep one leg comparatively on the upper side, and then they have to insert it through the vagina and they have to fix it above like this. This is what the way how they have to fixed. Now I have shown here by fixing the diaphragms. Now after the fixing, if the woman involved in the coitus activity, then what will happen, students? Actually, sperms are going to release in the vagina after by the end of the coitus activity, but they are not able to take a entry into the uterus. Why? Because the opening of the uterus is completely covered with the help of the diaphragm, cervical calf or the valves. Because of that, what will happen? All those sperms are going to remain in the vagina itself. And even they have used the chemical spermicides. That spermicides is the one such which will kill all the sperms which were released by that time. Yes, so that what the way how these diaphragm, cervical caps and valves are going to be utilized along with the chemical methods. And after if anyone is going for these diaphragm, cervical caps and valves, they have to understand that these are not going to help in prevention of STDs. No, they can only give the contraception but not the prevention of STDs. Yeah, I hope you are all understood. And one more thing is, if they are going for the using of these rest of the three, they have to wait about nearly 6 to 7 hours, minimum 4 to 5 hours. Yeah, after the last coitus activity, they have to understand after last coitus activity. Yeah, so after coitus activity, they should not be removed immediately. Yeah, no. Yeah, they have to wait. They have to wait. Yeah, up to the 5 hours or 6 hours minimum, and after that only they have to remove it, and again they can able to clean it. They can go for the reusing of that. Yeah, I hope you are all understood regarding the barrier methods today in this class. So please keep on watching the videos and even keep on writing. Yeah, I want to know that, students, what exactly the topics you want to have. Yeah, please comment and tell me in the descriptions. Yeah, so this is what the point we want to understand. This is what the topic we want to needed. So that you please keep on commenting, and according to your comments, yeah, so 100% I am going to even prepare the videos on that. And please comment on this video also, students. Yeah, because your comments are going to help me a lot to improve my teaching and even improve my videos also, video qualities also. Probably you might be observing my setting over here without fan or without AC. I am just preparing my videos. It is completely sweating, students. Yeah, if I made my fan on, so then it will be disturbance for your this audio quality will going to loss. Yeah, so that's why even without AC, nothing, I have preparing this video. So you might be observing what is the mind condition, students. Yeah, I hope so. Anyhow, this video has brought you the some sense regarding this all the contraceptive methods. Yeah, please keep commenting. Okay, so that will really help me to improve my videos and improve my teaching and even know most about the things. Yeah, you keep on commenting on this video also. And even please tell me in the description box what video you want and what better can able to do. Yeah, what can be do in the next videos. So that also you please keep on commenting and tell me in the description box, students. Yeah. Thank you, and please share it to your friends. And if you not yet liked, yeah, please like and subscribe my channel. And even you just press the bell button and select all. That's also important one, because after every just whenever I upload the videos, you will get the immediate notification, and you can understand that. Yeah, I hope so you are all understood the barrier methods, how they are going to used, and what is the role of them, but you must have to understand, students, yeah, whatever these all the barrier methods are there, even they have a failure rates. Yeah, so don't at all think that if we are using these methods there will not be any chances of the pregnancy. No, there may be chances, because these methods can able to go fail. Yeah, because of that, always keep it in the mind and go for using these all the contraceptive methods. Yeah, thank you once again, students. Bye bye, take care.